Hello. Today we will be discussing behavior evaluations within animal shelters, particularly canine behavior evaluations. According to data from the ASPCA, approximately 6.3 million companion animals are surrendered annually. Of those, 3.1 million are dogs. Of those dogs, approximately 390,000 are euthanized. Pet problems are the most common reason that owners rehome their pets, accounting for 47% of rehomed dogs. Pet problems were defined as problematic behaviors or aggressive behaviors that grew larger than expected, as well as health problems. Behavioral assessment. In order to evaluate a canine's behavior and assess its potential adoptability, it is standard practice for shelters to conduct a standard behavioral assessment on each surrendered canine. These standard evaluations are used as a tool to assess temperament and predict future behavior. However, current research indicates critical flaws within these standard evaluations. Issues interpreting behavior issues. In their work, No Better Than Flipping a Coin, Reconsidering Canine Behavior Evals in Animal Shelters, authors Janice Bradley and Gary Petronik discuss the defects of these standard evaluations. One of the problems the authors point out is the motivations, or the underlying motivations, when performing these behavior evals. They point out that an underlying motivation could be that shelter staff may be to remove or mitigate some emotional stress, so they don't have to confront decisions about euthanasia or overcrowding within the shelter. And this could affect the behavior eval as well as their conclusions about each dog. Provoking aggression is another issue. The authors also discuss that the most standard behavior evaluations involve provoking the dog in some manner. Tail pulling, placement of a fake hand in the dog's face, or abruptly entering the room in a threatening manner. And then evaluate the dog's reaction. This differs rather than providing a positive experience or interaction to then predict future behavior. According to Ben Bricker, who's the behavior supervisor at Midcoast Humane Society, he also mentioned the flaws in using these representations in behavior evals. He says that they utilize poor quality representation, such as dolls pretending for children, stuffed animals as a representation for living animals, a rope toy to represent prey, rubber hands for resource guarding, and a trench coat to represent novel stimuli. He says that we look to use these misrepresentations to extrapolate complex behaviors from animals that do not observe the representations in the same manner that we evaluators do. The trouble with diagnosing behavior problems. Authors Bradley and Petronik also note that there's little plausibility of having any definitive conclusion about behavior. They say, for a canine behavior evaluation, quote, diagnosis would involve ascertaining not only whether a dog did or did not exhibit a behavior of interest on one or more tests in the shelter, but also that the behavior, if it even occurred, constituted a stable trait that would then be expressed in other contexts, and that it also posed a threat. In that it's unlikely, in the unlikely case that the first of these conditions could achieve reliability, the other two remain entirely speculative. Bradley and Petronik, 2020. Timing is everything. For animals that are owner surrendered, the stress of abandonment from their owner, coupled with high stress environment of being in an unfamiliar, threatening new shelter, can be traumatizing for shelter dogs. This physical and emotional stress is now being evidenced by researchers such as Hennessy, who points out in his work influence of male and female petters on cortisol and behavior. The author notes that the HPA axis, which is the body's primary stress-responsive neuroendocrine system, was activated within dogs on their first day of being surrendered to the shelter. Not only that, but their cortisol levels were 3 times higher than that of a dog within its owner's home. The HPA activation was present for the first 3 days of the dog's stay before it began to decline on the 4th and 5th day. This is particularly concerning as most shelters have a standard evaluation within the first 3 days of intake, basing the dog's future of life or death within this time frame. Filling the gaps. To address these gaps in the validity of these standard behavior evals, we took a look at two local shelters and their standard behavior evaluation protocols. We reviewed the standard operating procedures for the 2 local shelters, and they had to align with our inclusion criteria. The inclusion criteria was that there were behavior evaluations and behavioral management protocols in place. Each shelter was contacted through email to secure their participation for this review. Qualitative data was collected through interviews with animal care and behavioral personnel. The standard operating procedure information was then compared to the standards set by the Association of Shelter Veterinarians. Comparing shelters, the following data examines the New Hampshire SPCA and the Burke County Animal Shelters Standard Operating Procedures of Behavior Protocol, and compare them with the guidelines set by the Association of Shelter Veterinarians. The results of the review conclude that each shelter does include a standard behavior evaluation as part of the intake process, along with behavioral intake, which serves as the determinant if a dog will move forward within the shelter, be transferred to another shelter, or if the dog is euthanized. The results indicate that the standard behavior evaluation is used to assess any immediate needs that the dog may have behaviorally, which would allow them to be placed in appropriate housing, as well as to discover any aggressive behaviors, including fear-based aggression. The results indicate as well that for long-term shelter stays, appropriate levels of additional enrichment are added, as well as that any mental suffering, distress, or behavioral deterioration is assessed appropriately and treated in a timely manner, or that animal is humanely euthanized. What do these results mean? Although the results indicate that the minimum standards are being performed by both shelters, the SOPs do not include potentially limiting protocols in their behavior evaluations. The research has proven that false positives are created, including a false positive of aggression, which would result in that dog being pulled and humanely euthanized. What is not included in the SOPs that should be? As Laura Reese states in Strategies for Successful Animal Sheltering, shelter evaluations tell us more about the effect of the shelter as they do about the individual dogs. She points out that the nature of the staff themselves can affect the results. Staff training and regulation should be done from a professional animal behaviorist continually, and as well as the staff should be monitored that they are performing the behavior evaluations up to the standard of the Association of Shelter Veterinarians. What else should be included? Protocols that take into account the situational/environmental effects of the shelter environment, which we know has psychological as well as physiological effects of the dogs after admittance, should also be included in future standard operating procedures when it comes to behavioral evals. Key takeaways. Although the two shelters reviewed and include the minimum standards set by the Association of Shelter Veterinarians, they are not enough to mitigate false positive results of aggression due to factors proven to affect results. Additional protocols must be put into place in regards to location where the behavior evaluation is performed, by whom the evaluation is performed, a trained behavioral personnel, and when, how long after admittance the behavior is performed, in order to safeguard the lives of shelter dogs. Thank you for listening. I hope you learned a little bit about canine behavioral evaluations as the standard is set now and what we can do in the future. Thank you.